nutritional sciences, you mentioned longevity science. I mean, it's at its sort of infancy, right? There is a lot of promising work on it, but we need to give it more time. But generally speaking, nutrition science is very complex, right? Tell us
Yeah, complex is one word. Complex is one word to use. You know, there are some other less positive words, I guess you can use too. I mean, it's terrible. Nutrition science is terrible, and we're making decisions about what to recommend for people's health based on some of the lowest quality science, and it just makes you wonder if we're just better off not having a lot of these studies. You know, these multi-center, multi-country observational studies with hundreds of thousands of people, where you control nothing and you just crunch the data and look for associations and say, oh, look, here it is. They eat more red meat, therefore red meat's the problem. Therefore, if you reduce red meat, you're going to be healthier. And when you look at the data and you tear it apart, it has nothing to do with the conclusions, because the people who ate red meat were much less healthy at baseline. They're more likely to smoke. Does that mean red meat causes you to smoke more? Absolutely not. But that's the same thing as saying red meat causes you to have more heart attacks, because there's the same association there. And when you look at these hazard ratios, like how much is the difference? They're like 1.1 and 1.2. And the reference I always like to give, smoking, you know, people say, well, there was never a randomized controlled trial about smoking. Well, no, because the hazard ratio was like 15, 20, 30, depending on the study. Not 1.30, but 30. And here we're talking about 1.1 and 1.2. So they're orders of magnitude different. So, I mean, to try and use that type of data to inform what an individual is supposed to eat is terrible. Like, how could we even assume that that's going to be anywhere near accurate? But yet that's what we're dealing with for the majority of our nutrition science. So it's pretty bad. And we'd probably be better off without the recommendations, without dietary guidelines, you know, without trying to make sense of this data, and instead trying to use higher quality data or use, you know, personal experience more about to figure out what diet works for you, than assuming there's one diet based on these very poor quality trials or studies, not even trials.
I believe you've covered one of those terrible studies in your one of your analytical videos for on Diet Doctor. I think it was about diabetes, and being type 1 diabetic, I'm always fascinated by diabetes in general. And it was a study about, again, red meat. Could red meat be causing diabetes? But of course, in the conclusion, they do mention that, oh, mind you, the red meat eaters were also eating the bun with it, were also eating the French fries, and were drinking more Coke and eating more pastry. And so, are biases also playing a role here?
Sure, absolutely. And, you know, let me clarify one thing. I said it's terrible science. And what I really should say, it's a terrible use of science, right? The study is what the study is. Not like the researchers did anything wrong, or they conducted the study poorly. It's just a misunderstanding of the strength of the study and how to use it to inform individuals. So that's the terrible part. I don't mean to put down the scientists doing the work. It's the interpretation and the use of the science that's the problem. And that's exactly where biases come into play. Because if you find a low quality study that fits your bias, it's really easy to ignore the fact that it's low quality evidence, because it fits your bias, confirmation bias, let's go, you know, I was right all along. Versus if you find a low quality study that goes against your bias, then you tear it apart and say how low it is. I've done that. I can own that. I've done that for sure. So I think that happens all the time, and we all have to be much more self-aware about that, about what our biases are. And that would help us, I think, interpret the science with a little bit more attention to the quality of the science, and understand that the strength of the recommendation needs to match the strength of the science, and that's frequently not the case.
Yeah, so even control studies, clinical control studies, even those can be, the data can be misinterpreted or manipulated. Any thoughts on that?
Yeah, I mean, randomized controlled trials are a higher level of evidence, but how you design the trial makes a difference, right? Is it only 18-year-old healthy males in your study, and then you're going to try and apply the results to a 50-year-old female with type 2 diabetes, right? Like, look, the randomized controlled trial says this works. Yeah, but it worked for what and in whom and what duration of time? And then does that relate to the population you're talking about or the individual you're talking about? So even though it's a higher level of evidence, it still can be really misinterpreted. So you need to know exactly how it was designed, what was the question, what was the population, and what was the result. Like, all that matters. It's a lot to ask people to do, right? People who don't have training in medicine and science and nutrition, it's a lot to ask them to do to interpret this. So it's up to us as clinicians, as educators, as voices in the nutrition community to try and be as open and honest and critical as we can about these studies so people can understand the differences.
I was just about to ask, I mean, how does a layperson with no background in science or nutrition trust what they read? Because the media headlines, people don't even read the full article, let alone going to the study and trying to interpret the study themselves.
Yeah.
But it's just the headline, and the headlines are sensationalized, and they really don't do the studies any justice by, you know, it's difficult to get through to lay people without a background in science.
Yeah, it's depressing to think about, isn't it? Like, it's really like depressing, like to see what we're up against and what the average person is up against is a little disheartening. And that's where, I mean, I just encourage people to find that selection of voices of people that they can trust and that they have a good track record and that they can believe and that is critical about the details, and follow them and try and hear more about what they have to say, and hopefully that can help. You know, and the basics though of just not falling for nutrition epidemiology studies as being, you know, something that really you should pay attention to as an individual. That's like a basic thing. But then it's really about finding those trustworthy voices and following them. And that's, you know, that's what I hope to be for some people, and what Diet Doctor hopes to be for many people, to really be that source of trustworthiness.